And so we're just seeing an explosion that's happening in veterinary medicine today. All of these technologies are all being developed simultaneously, and they're slowly rolling out into the market, but we're just going to see more and more of them.
For this episode, I was joined once again in studio by Dr. Aaron Massachar, and I always have a lot of fun and I learn so much from these conversations. And in this episode, we're breaking down some of the terminology and uses of AI in veterinary medicine, specifically the roles these tools play in our day-to-day practice. You may have heard terms like agent and co-pilot tossed around when it comes to AI. I hadn't. These were new terms to me. And I really hadn't thought about, this type of terminology and how it applied to the roles that AI is playing in our day-to-day lives and in veterinary medicine until we started talking about this episode. This discussion, I know, helped me just make better sense of how these tools are already influencing life and practice, and I hope it'll do the same for you. We also talk about how AI can help us stay on top of the rapidly growing body of medical knowledge. With new research coming out every day, having tools to help us sift through it all and bring the most relevant information to the top can really be a game changer in certain cases. We tried to keep this one short and sweet in hopes of wrapping up the basics into a neat, easy to digest package, so hopefully we accomplished our goal. Let's go ahead and jump in about how AI is shaping vet med today and where it might take us next. But first, let me tell you about my guest, Dr. Aaron Massachar. Dr. Aaron Massachar is the Executive Director of the Veterinary Innovation Council. After completing his PhD in philosophy at the University of Guelph in 2011 and then teaching for 5 years, Dr. Massachar transitioned to veterinary medicine, where he believed he could have a greater impact than what could be done in academic philosophy. His first work in veterinary medicine was with Texas A&M, where he helped to build the Veterinary Entrepreneurship Academy and the Veterinary Innovation Summit. He later started working on telemedicine with the Veterinary Innovation Council in 2017. While at Vic, he helped to build educational programs for the North American veterinary community and later became the Senior Vice President of Learning at the NAVC. After serving in senior executive positions with Colorado State University's Translational Medicine Institute and the Veterinary Emergency Group, Dr. Massachar is back at the Veterinary Innovation Council, helping to drive awareness across industry in domains such as innovation, entrepreneurship, and artificial intelligence. Aaron and his wife live in Colorado with their 3 dogs and 2 cats.
Looking to protect your canine patients against parasites? Look no further than Simparica Trio, Serraline Moxidectin and Pyrantel chewable tablets. The first chewable to offer triple protection from heartworm disease, ticks and fleas, and roundworms and hookworms. It's also FDA approved to block infections that may cause Lyme disease by killing deer ticks.
Use with caution in dogs with a history of seizures. Serraline belongs to the isoxazoline class, which has been associated with neurologic adverse reactions. The most common side effects were vomiting and diarrhea.
Visit SimparicaTrioDVM.com for full prescribing information.
We're joined once again by Dr. Aaron Massachar. We're going to go ahead and talk a little bit more about technology, and we have promised ourselves that we are not going to go into, more broad conversation, shall I say, about, the long-term implications of technology and really talk about some of what is out there now. So thank you for joining me again.
It's awesome to be here.
Yes. Happy to have you. So in our last conversation, we brought up the words co-pilot and agents in terms of some of the technology that we have available now. So can you expand on those terms a little bit?
Sure. So we're seeing that in the scribing software area, right? So a lot of the companies initially started with just basically transcribing a conversation that you would be having about a client and about their animal, and then turning that into soap notes, and then from there, we're just starting to see more and more features being added to that. So everything from, we had talked about burnout before, but differentials, leveling systems. So being able to provide you with feedback on how well you communicated one thing rather than another, built-in things like templates and discharge summaries and educational materials and all of that kind of stuff is all being built into these scribing software tools. And so we're seeing them change from just scribing on its own, to more of a co-pilot and being able to facilitate that. And then down the road, we'll see a lot more autonomy built into that. But I think that that's just one area that has really taken a hold because of some of the things that we talked about before. So it's really good in terms of minimal workflow interruption. So right away, there's not much that you have to do in order to start using the technology and bring it in. The other thing is that it saves time right away. And so the thing that really kicked all of this AI conversation off, though, was radiology. And companies like SignalPet, when they came into the market and said, we can provide you with, at minimum, regions of interest. So you would run your radiographs, it would come back and say, you should pay attention to these areas. Some of the companies started talking about it being a diagnosis. And the more that I talk with some of these companies, the more I say, please don't say diagnosis. Please say like screening or assistive technology or something like that. Because as soon as you start saying diagnosis, then it gets people's hackles up and it's not a good situation. So radiology was one of the first, caused a lot of controversy. And now it's just, I think the latest that I looked from SignalPet was something in the neighborhood of, well, this is actually kind of a fun little experiment. Boarded radiologists, how many films do you think that they read, say, a day?
So I wouldn't even begin to guess, because radiology is an area for me where I've continued to struggle. I do know, when we've talked about things like SignalPet, and I don't know if this plays into what you're saying, we've talked about studies where they've given radiologists all the same x-ray and they come back with vastly different interpretations in some cases.
Yeah.
So I'm sure there's a lot of variability and subjectivity there.
There totally is. So just to finish that thought and then we'll jump into that.
Yeah.
So I did some math, and if you look at it over, say, the course of a 30-year career of a boarded radiologist, if they're working 5 days a week, they're reading on average maybe somewhere in the neighborhood of 300 to 400,000 films over the course of their career. Okay. SignalPet has read, I think it's either 2.9 or 3.9 million in the past year.
Wow.
So if you just think about the scale.
Yeah, the
right?
number of boarded radiologists it would take for that level of interpreting, I use that term loosely, interpreting films.
Yeah. And so there's a lot of questions about the value of that interpretation, the extent to which they can do it, and all that kind of stuff. But the algorithms are being trained really, really well, and so they're just getting better and better over time. Okay. So then there's a bunch of super interesting things like, I think it was ultrasound appointments. So this is on the human side. They would give doctors films to interpret from an ultrasound perspective, and they would say, okay, what do you think is happening on this film? And the doctor would say X or Y, whatever it is. And then they would go back a month later. And not only would they disagree with other doctors about what's going on, and so there's definitely a high level of subjectivity about what's going on, but a month later, 20% of them would disagree with themselves about what's happening in that interpretation, right? And so you're like, whoa, there's a whole level of subjectivity that exists in this stuff.
I always knew the imaginoscopes were a real thing. Always knew it.
So that's one of the challenges that AI is hoping to tackle, is to bring some level of objectivity to what's going on. And are the tools perfect? Absolutely not. But are they getting better? They definitely are. And you have companies like Radamel, for example, that was built by a boarded radiologist and somebody with deep experience in machine learning. And so those two people put together are going to create a great product. It's all other things being equal. So they not only are providing the AI reads of the films, but then you can also kick it over to a stat read. And so then boarded radiologists would read that. And then they're taking any time that those boarded radiologists have and verifying what the AI is doing. And so they're just constantly retraining the algorithm to get better and better and better. Okay, so that's happening in radiology. That's happening across the board. So when you start looking at, radiology, ultrasound, endoscopy is the same thing. So there's computer vision endoscopes that are being used. And so it's the same kind of technology that you would normally use for endoscopy, but it's being fed through computer vision to be able to identify regions of interest that are, some of it is just things that you would normally see, but it's just putting a box around it and saying, hey, paying attention to this. But then there's a bunch of stuff that you wouldn't normally be able to see or the human eye cannot see. And so it's picking up on things that give it superhuman intelligence. So that's endoscopy. So that's computer vision. Then when you start looking at how computer vision is playing out in other areas. So for example, this is another one of those things where I have yet to meet a veterinarian who likes to have a conversation with an owner about body condition score.
Oh, gosh. Yeah, those can be touchy conversations.
So there's a company out there called Companion, and Companion is using computer vision in order to give your animal body condition score. And you're like, oh, well, that's kind of interesting. And then they were developing this in-house. So it was a piece of hardware that would sit in your house, and you could actually train your animal with it. So it would train your animal to sit down because it would notice when it was sitting down, and it would give it a treat. So positive reinforcement, and that was pretty cool.
Oh, yeah, I need one of those.
And then they started utilizing that to be able to do gait analysis. And you're like, okay, well, that's pretty interesting because gait analysis, you might be able to detect things like lameness or something like that the owner, it might take them a little bit longer. So maybe average owner is going to bring in the animal after like 2 months of lameness. Maybe it can pick that up from like day one and say, this is something that you need to see right away because could it be cancer? Or could it be because they've got a thorn in their paw? Or could it be, there's a bunch of different reasons for that. So that was all hardware in-house. And then that hardware went away, or I think they still have it, but they're not really selling it anymore. And now that is being put into places like Ring doorbells and cameras that exist in your home. And then they're starting to look at, well, can we bring that into pet stores and veterinary clinics to be able to say, let's give them feedback at the moment that we notice something wrong. And so just think about that, like how often do we miss things because the animal's just behaving a little bit strangely when they're in the clinic, and so you don't see the strange gait. But if you could understand what's happening in the home and have real-time information on all of that, like that then becomes really powerful. Okay, so still within the realm of computer vision, we normally think about it as like normal vision, like we would see the colors of the things in our environment. But then we have thermal imaging, and we have infrared as well that can be built into these cameras. And then when you think about things like herd management, we know that if there's a spike in the temperature of a particular animal, there's a greater likelihood that there's some sort of disease present. At minimum, you should take a look at that animal. But how often are you getting that information? So there are companies who are building drones that are flying around with thermal imaging on the drones to be able to identify animals that have a higher than normal body temperature, to be able to pull that animal out and give that animal an exam. Okay, so that's interesting. And then there's like udder analysis. So Cornell did a bunch of work with computer vision to look at everything from swelling to temperature to scarring to all of that on these cows as they're moving through a dairy farm, to be able to say, yes, there's something wrong with that. And they did it really low tech. Well, they just had GoPro cameras, and then they were running this algorithm on top of the images that they were getting through that. So there's that area, and you just keep going and going. Cytology, anything that involves visual media, you can run these AI algorithms on top of it. And so we're just seeing an explosion that's happening in veterinary medicine today that is reducing time to diagnosis. Is it costing more money? Maybe short term, maybe long term. It could not, depending on how it's being used. But it's just being used across the board. And it's being used by large diagnostic companies like IDEXX and Zoetis, and they're providing point-of-care AI tools to then be able to give you the resources that you need in order to diagnose something more quickly, instead of waiting for like a 2-week turnaround as it goes to the reference lab. What could you do if you had that information in-house? It's like doing stat reads versus like going into the darkroom and like printing off these films and then mailing them off. And so what could you do if you had that information right away? So all of these technologies are all being developed simultaneously, and they're slowly rolling out into the market, but we're just going to see more and more of them.
I'm sorry, I'm still stuck on the mailing films off because that never actually occurred. Like I didn't dip films, but we had an automated generator, but you did have to like go into the room in the dark and feed the cassette in, and it would give you a film back. But this tells you how far technology has come so fast. When you said that, this is not at all what you were talking about. This is where my brain went though, was I went, okay, then, we would get our film and we'd put it up. I still don't understand how we ever read them because that compared to digital or even computed radiology is totally different. But it never occurred to me, if you needed a specialist consult, that you would potentially mail these films off. And my head went, well, why wouldn't you just take a picture with your phone and send them that? I'm like, oh, because we couldn't do that. And that didn't exist that long ago. Yeah. So, okay, I was like, oh gosh, mailing films. Yeah, I guess we did have to do that at some point. But I can see the value in so many of these. And particularly when we're talking about radiology and things like that, I almost look at it as an access to care type of situation where in some hospitals, you're going to have a specialist consult or some form of that built into the radiology fee. And now I feel much better about those fees because when I question myself on these x-rays, like it sounds like even boarded radiologists are doing this and questioning what they're finding. But that's not always the case. Sometimes we have to add on this specialist review, and we don't, oftentimes we have clients who say, I can't afford the extra fee. I'm going to have to rely on your interpretation. And that's a lot of pressure on everybody involved. So even if we can have an AI say, hey, take a look at this area as a potential problem area, it seems potentially easier to bake that charge into a fee where we're having that AI backup to say, hey, look here and look here and look here. And then we can kind of like we've talked about before with scribing software where we have to go back and check it, giving us a reason to go back and check of, oh, I was, doing a chest x-ray. I didn't realize like I caught the elbow and there's something going on there. Let me go back and look at that because we're in a hurry. Mm-hmm. And that's a whole nother talk as to why we're in a hurry. But I can see the benefit. And, we're talking about the thermal imaging and gait analysis and fascinating and hugely important in herd management because it can be really hard to single out individual animals that are having a problem before it gets severe. But I also think about it in terms of our companion animals and how much more value people could get out of an annual exam and how much more information we would be able to give to people. I especially love the idea of an independent technology talking about body condition score, so I don't have to have that conversation. Yeah, I can just see medicine being so much more thorough, I guess maybe is the word, and really providing a lot more value in a time where we're talking about access to care. But of course, to your point, when you talked about the cost, is it going to save money? Is it going to cost money? Probably depends on the technology and how we're using it. But if this can be something that's used on a wider scale, I think there's a lot of opportunity there to provide a lot more benefit in a model that we're already using.
Yeah, the naive optimist in me would love to think about this as really dropping down the cost of care. So if you say, for example, all things being equal, instead of paying a boarded radiologist $250, $300, whatever it is for a stat read, you can get the same level from AI for, say, $5. That's not really the place that we're in right now. Maybe that's some future state, but it's not on the immediate horizon. And so you're still getting a much higher level of care if you are going to a boarded specialist. But to your point, if somebody looks at that and says, I can't afford that, and you can provide, say, a higher level of interpretation by leveraging AI and driving down the cost from $250 to $300 down to like $5 or $10, and that's like enough, to provide the owner with a deeper level of security about what's going on and for you to feel a little bit more confident, that's a good thing. And then we start thinking about like telemedicine applications and the ability to reach a wider audience with these. And yeah, I would love to say that overall, this is going to drive down the cost of care. I think in narrow instances, it will. But the cost of care is just going to continue to increase, especially if people think that they need to be all kinds of doctors to all kinds of people. What we're seeing is that people are segmenting that out. And clients are doing this, whether you're aware of it or not. Clients are typically going to like vaccine clinics, or they're going to like some other like low cost alternative And then having a GP as their like standard, right? Where if something's going wrong, then they go to their GP. But for some of the other things, and a lot of the clients are ashamed to admit this to the GP. And it's really unfortunate because the GP wants that information, right? As a doctor, you want to know, if you have gone somewhere else, like, tell me, at least so that I know what's going on. I have a bigger picture of what's happening with the health of the animal. So if some of these technologies are enabling a greater level of segmentation of the business model to then say, I'm only going to focus on AI use of technology and drive down the cost of care, maybe, but across the board, it's not going to get cheaper.
Right. But I think it does speak to the need certainly within the veterinary industry and probably in many industries to address that problem and acknowledge that it's a problem and find creative solutions for how to deal with it. So, like you said, in some cases it might not drive down the cost of care, but we might have a segment of clients who wants that level of care. And in those cases, it can be applied, and the information that we get from using it in those scenarios can help other animals where maybe we're not using that technology.
Yeah.
But we're creative, we're smart in this field, and so I think having this information and these resources, even if they're not directly driving down the cost of care, they can help feed that creativity and help come up with solutions.
For sure, because like we talked about earlier, they're not going away. When you start looking into it a little bit more, you start seeing that almost everything that's being developed today is using AI. So everything within the clinic, right? When you think about even like CAD designs, or you think about the software that's being created that's running some of these tools, or if it's clearly stating AI algorithms are being used in order to interpret this like fecal or urine sample or whatever, like whether it's clearly stated or it's just kind of built in, AI is being used across the board. And so it's not something that we're going to be able to get away from anytime soon. And so then how do you think about that? There are people who are saying things like, we have to inform clients whether or not AI is being used. And today, that might be the case where you can look at a piece of like VetScan Imagist or SediVue, by Zoetis and IDEXX. These technologies are using AI and they're clearly stating that. But if every bit of that technology is leveraging AI in some way, whether it's in the design, implementation, or execution by the veterinarian in the clinic, how are you ever going to know whether or not AI is in there? And so there's a lot of like challenges that are going to come up about as a result of this. The thing that the majority of the organizations like American Association of Veterinary State Boards, the recommendations that they're going to issue are going to be things like, it's ultimately up to the veterinarian. So if you don't know what's happening, whether you're using radiology or you're using any of these technologies, if you don't know what's happening and you're just going with whatever the machine tells you, ultimately it's your license that's still going to be on the line. And so at minimum, you have to have a level of curiosity that allows you to say, what is happening with this technology? What am I comfortable with? What am I not comfortable with? Because it's really up to you as a veterinary professional to determine whether or not it's appropriate.
Sure. And so with that concern of, we're being replaced by technology or you're by the robots and things like that, it sounds like really, kind of the opposite, where it's giving us more tools for consideration, if we're able to implement some of these tools, and then allowing us to maybe make a better interpretation. But like you said, ultimately it's our license that's on the line. So if we just hand it over to technology, then we're creating a lot of problems for ourselves and for our patients. So maybe at least in many contexts, if not all of them, looking at it not as, now this technology is doing my job, more so as I have information and I have reasons to go look in places that I might not have gone to on my own, and to use that to try to make a better interpretation and create better care for patients. I mean, what is it? Our medical knowledge has doubled in the last 10 years, where it took us 50 years to double before. It sounds like we're just still on that track where it's just going to get faster and faster. And the more information we have, the more tools we're going to need to help know what to do with that data and interpret it, because it allows us to do what we all wake up to do in the morning and go provide better care to animals.
Recently, I heard this quote that its medical information doubles every 72 days.
72 days?
72 days.
Oh my gosh. That sounds realistic to me, because I think about that a lot in some of the conversations that we have on the podcast, where I'm going, I don't think we were talking about this 6 months ago.
Whether it's 72 days or 720 days, the fact is it's impossible to stay up to date. I did just a little bit of research a little while ago to determine how many veterinary articles are produced every year. And it's somewhere in the neighborhood of, relating to veterinary medicine, around 20,000 articles are produced every single year. And so in order to stay up to date, and if that number remained constant, instead of doubling every 72 days or whatever it is, you would have to read nonstop for 32 hours a day. And I'm not a genius when it comes to this stuff, but I think that there's something challenging about that makes it impossible to do, right? So it's nearly impossible to stay up to date. And so that's why some of these decision support tools are going to be so helpful, is that you don't have to do the work of reading articles 10 hours a day in order to stay up to date. These tools will pull in that information for you and serve to you what is going to be most relevant for that particular case. And whether that was published 10 years ago or 10 minutes ago, it's going to be able to grab that information for you and serve it up to you. And that to me is really exciting, because then you're constantly up to date. You know exactly what's happening. You have all the information that you need to make the best possible diagnosis.
Well, and I think that's another thing that I tend to talk about in a lot of the content that we create, both on the podcast and in other platforms on VetFolio, is I talk about wanting cookbook medicine. And like when I am standing there looking this dog, this cat, or whatever animal it is, in the face and talking to this owner, and I need to make a decision now, I don't want to know, oh, well, you should choose an NSAID and this and that. No, I want to say, pick this specific drug at this dose and give it for this length of time. And of course, getting that information from a co-pilot like what we're talking about here comes with a level of interpretation of, is that drug appropriate? Is that dose appropriate? Do I feel comfortable there? But when you're in that moment, I love all the articles, and I'm so glad they exist, and I'm so glad we're publishing. I don't have 32 hours a day to read them, unfortunately. But so in that moment, I really want something that can say, do this, or, in the case of x-rays, look here, think about this, and help to narrow it down and get us to that relevant information where, like you said, then we are up to date. Then it's not, well, I'm operating off of what I've done for the last 10 years. It's, this is what the latest recommendation is.
Mm-hmm. And that's exciting.
That is exciting.
To be able to leverage all of that simultaneously.
Yes, all that information at your fingertips, and then medicine progressing that quickly on top of it, and just continuing to be able to get more information that you can use to then create more effective treatment plans.
That's the idea.
Well, I know that if we keep going down this road, we're going to talk for another 30 minutes here.
Yeah.
And I've been, slowly wrestling a baby boxer in the background who is determined to unplug my microphone.
She's doing a really good job of it.
She is. Oh, she's trying hard. I think are you sending us the message here, puppy dog? So, Erin, thank you again for joining me. This has been a lot of fun. I've learned a lot. I can't wait to have more conversations along these lines. If we wait more than 72 days, it sounds like we're going to have even more to talk about.
Twice as much, at least.
Yes.
Yeah. I love being on this with you and having these conversations. I don't get to talk to a lot of practicing veterinarians, and so it's really great to get your perspective on these things.
Awesome. Well, anytime, come back and we will dive into this, and our poor production team will buckle up for our hour-long conversation that we did a good job, though, today, cutting ourselves off.
It's awesome.
Gosh, the opportunity to record 2 episodes face-to-face in studio. Man, this was so much fun talking about all things AI and technology. Truly, most of it is way above my head, so I really learned a lot from these episodes. I hope everyone listening did too. Thank you so much, Erin, for joining me. Thank you to everyone tuning in. If you enjoyed this episode, please leave us a 5-star review wherever you get your podcasts. It'll help other veterinary professionals like you find this and other great content we try to put out there. If you enjoyed this episode and would like to hear more, you can click on the education tab on the VetFolio website or find us wherever you get your podcasts. As always, I'd love to hear your thoughts on this episode, as well as ideas for future topics you'd like to hear. Feel free to reach out to me at dvm@vetfolio.com. You can also connect with me on Facebook at Dr. Cassie DVM, or follow me on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.